My name is Dr. Danielle Tolman. I am a vestibular physical therapist who specializes in the treatment and evaluation of dizziness and vertigo and inner ear dysfunction. And I'm here to dispel some myths about Meclizine, which is an anti-motion sickness drug that can be used in our patient population or for people who are dizzy. It's getting a little bit of a bad rap for a pretty good reason. However, there is a time and a place to utilize it, and that's what I'm hoping to talk about today. So Meclizine is a drug that a physician or somebody might prescribe to patients if they're having complaints of dizziness. It's very easy to get your hands on. It's very inexpensive, and it is good at suppressing that inner ear or vestibular system to prevent us from getting too dizzy. However, if we are on it for too long of periods of times or inappropriately for maybe just some mild chronic dizziness, it can actually potentially make you feel worse down the road. So when should we use Meclizine or these anti-motion sickness medications like Dramamine or Bonine? We should use them when you're having acute episodes of room spinning vertigo that really just render you non-functional, really taken away from quality of life. A lot of times we see this for people who have a very sudden onset of loss of function of one of their inner ears. And you can see this with vestibular neuritis most commonly, labyrinthitis, other people who might have severe episodes of room spinning vertigo that last more than a couple of seconds would include Meniere's disease. So with that being said, yeah, if you are in a moment of crisis and you are feeling absolutely awful, it is also an antiemetic, so it will help kind of keep that nausea down. You want to take something in those instances. However, if you just have this chronic sense of imbalance or dizziness, rocking, swaying, we want to get off that Meclizine. We want to allow your vestibular system to not be suppressed so that it can move and function and learn how to get better. There is a difference between the different things over the shelf. So you can get Meclizine for a prescription from your physician or from urgent care or whoever might be writing those prescriptions for you. Or you can simply get something over the counter right off the shelf at your grocery store. There is Dramamine less drowsy, and then there's Bonine. Dramamine less drowsy and Bonine both have Meclizine as the active ingredient in their formula. When you look at regular Dramamine or Dramamine original, they have dimenhydrinate, which is a more effective motion sickness medication. However, it has that more longer lasting effect of making you feel more drowsy. So if you need to be able to be functional during the day and you don't want to just sleep it off, you can always look for that Bonine or Dramamine less drowsy. If you're really going through it and you're really feeling awful, room spinning, severe motion sickness, dizziness, nausea, vomiting, you want to look for that Dramamine original. Hope this was helpful. If you like some of this content, be sure to follow us and we'll talk to you guys again soon.